All right, I think we should be able to get going here. So thank you all, everyone who's joining in and attending today's version of today's episode of our Let's Talk About series, where we are doing a daily presentation in honor of Suicide Prevention Awareness Month. Each weekday at noon, we're joined by at least one guest, and today we have State Rep Sarah Hannon. So pleased to have you today, Sarah. Thank you so much for joining.
Erin, thank you so much for the opportunity to talk with you and your workmates and interested constituencies. Pleasure to be with you. And of course, it's a sunny day, so we're all inside right now.
All inside, but we care about the cause so much that we're willing to make the sacrifice. And for anyone who's watching on Zoom, we have closed captioning available. The instructions for captioning are in the little chat box. And if you're on Facebook and would like to see captions, there's a Zoom link there to connect you. So Representative Hannon, you represent Lemon Creek, downtown, Thane, Douglas Island, Gustavus, Haines, Skagway, and Klukwan. You've got a nice little chunk of territory here in Southeast, and you represent us on a lot of different issues. And I think what we care most about is mental health and suicide prevention. That's what we do at NAMI Juneau and the Suicide Prevention Coalition. Can you just tell us a little bit about what happens in the legislature related to mental health and suicide prevention?
Well, and I guess just the disclaimer at the beginning, I am not yet 2 years into being a legislator. I'm in my first term, so I'm still a freshman until that November election. So, you know, lots of times people talk about what usually happens or how things are supposed to go. And from the moment I was elected, things have been unprecedented is the word that gets used, already an overkill before we started a pandemic on top of it. And I would say that I ran on the largest motivating factor for me was Alaska needs to talk about its fiscal reality and have a solid plan. And with regard to mental health and suicide prevention and everything else, every policy, for the 18 months I've been serving, it's about the lens at which what we're willing to pay for those things. The policy questions come after that. And so we have not had much direct policy engagement. You know, what the closest we come is the dialogue of we need to do better, we need to do more, we need to turn the needle, but those are happening separate from everybody's taking a cut in their budget, and anyone who's working directly in services can't fathom how everyone who's dependent on public dollars has seen real cuts in programmatic deliverable dollars for the last 7 years. And we were never doing great before those cuts started. We still had one of the highest rates of suicide in the nation, especially among young people, especially young males, especially young Indigenous males. We have such high rates of addiction and abuse and neglect. And then we've cut our budget for 7 years. And it's hard to talk about policy because anything you do takes money and time, or takes time, and time is money. So we don't spend much time thinking about the sort of the holistic lens of, in a perfect world, what should we be doing and how do we get there? We spend our time talking about for a few dollars, what are we getting? And it's kind of a sad sense because we're not far enough away from what we need to be doing that we can look at it holistically. You know, it feels like we are continuing to Band-Aid and Band-Aid and Band-Aid and Band-Aid, but we still might be, needing much more complex medical interventions that we're seeing. I think the pandemic has presented an interesting, has really brought to a head some of the fissures in the systems of delivery and the approaches to treatment that anyone who's working in behavioral health or suicide prevention already knew. Things like the overlay with homelessness and housing first models and programs and but none of those change the outcomes immediately. They are systemic changes that we are working towards, and really proud of Juneau to be able to bring online the second phase of the Forget Me Not Manor program, and to be able to take more people off the streets. And in theory, that helps a whole lot of people get success, get help. So that's the not optimistic how we talk about it.
Yeah, and I think
let you ask another question.
well, no, that's a great framework. I would like to give you all some credit. Like with the cuts, I think that the state is still funding some great organizations that are doing awesome work. The State Suicide Prevention Council, which I know that you are involved with and a supporter of, did a presentation with us last week on the 10th, and that was excellent and well attended from folks around the state. The state funds wellness coalitions like our Suicide Prevention Coalition and like others around the state. And the different work that the wellness coalitions do is incredible. And like I see folks getting together to talk about like what metrics should we be monitoring to state long-term to see like, are these rates of bad things, for lack of more eloquent term, going down, and are the good things going up? So bad things like days spent feeling mentally unwell, and do you have trusted people in your life? And like these wellness coalitions are getting together to add some questions to the Youth Behavioral Health Risk Factors Survey that's administered to kids, and the Behavioral Health Risk Factor Survey that's administered to adults, to like further this monitoring. So I think that even with this diminished funding, like we have some cool people doing some cool stuff, and it's a joy to see and work with.
Yeah, we have across Alaska, instead of developing a huge bureaucratic state agency of delivery of those services, I don't know when it started, but we seem to be a state that has put much more of it into the nonprofit sector and grant funding to do those, to deliver at the local level, knowing that every community's service model is going to look different, because the best service delivery is at the lowest level of intervention that you can provide, as safe as it can be, as close to home as it can be. But we're going to be really hard pressed in the next 2 years, because we are facing $3 billion deficit in our operational costs. And, a lot of the political rhetoric is, we'll only do the things that we are mandated by law to do. And that's where you start getting people going, well, we don't have to have things like suicide councils. And, that came up 2 years ago, right after I got elected. And the questions that were asked was, prove to us that you've prevented suicides. Well, one, anyone who's ever done debate or rhetoric knows you can't prove a negative. Yeah. So if you've done your job, the statistics should reflect it, but you can't take credit, especially because the state council doesn't do those direct service deliveries. A helpline may be able to have very good intervention records on people they've directly intervened with at that crisis moment and have gotten them through to stable or thriving, but you don't really have that kind of follow-up in the systems of mental health to know that that call 5 years ago was a success and the second call wasn't. But we know, and we continue to see, again, just in this community where we have the regional hospital, that Bartlett Regional Hospital in the last 6 months of a pandemic has seen a substantial uptick in mental health service demands, and first time people asking for services, and families with young people. I was recently in a meeting, it was briefed, and we looked at the adolescent numbers with the school district, looking to, we're seeing a substantial uptick in those service demands and needs and crises in families. And we know that in Alaska, when we have a high rate of suicide, you don't want the initial interaction on mental health services we want to derail that before the most negative outcome that we can imagine gets there. And we know that for most people who ever die by suicide, there are indicators and mental health crises preceding that we don't always notice, and we don't always have the tools to intervene in, and we're not always successful in treating. But that's the goal, so we have to work towards a 0 rate of suicide in Alaska, knowing that's never going to be achievable, but that's our goal, all of us together.
Yeah, absolutely. And I think that's a lot of the difficulty in advocating for mental health services, and particularly prevention services. You can talk about processes, you can talk about the number of people you've seen, we can talk about the number of trainings we've done and the number of people who've shown up to those trainings. But we don't know what didn't happen as a result of those, exactly to your point. We can hope, we do know in general, like there is research that reduction in stigma increases help-seeking behavior and things like that. Help-seeking behavior is obviously the first step to getting better, so you don't feel so hopeless and alone. We know that hopeless and alone are drivers of suicide. But these are all like, we can identify links in the chain. We can't say like, yes, that bad thing never happened. Great job, boss.
Yeah.
And so what resonates with you in the legislature? For folks doing prevention, like what can we tell you and your colleagues to brag about our work? Like what would resonate, what would help our cause if we do want to advocate at the state level?
Well, I think always talking about, so let me translate it into legislative terms. So if you're going to be at lobbying, you're trying, well, and I was a high school teacher of American government, and what you always say is, every teenager is an expert lobbyist. You have figured out how to present the problem and the answer that you want to mom or dad, and you've got strategies as to who you go to first and what you know to do. The strategies are probably different depending on the adults who have authority in your life. You use one strategy with one and a different strategy with another, and citizens who aren't the electeds trying to influence electeds, whether it's city council boards or governing boards of nonprofit organizations, the techniques and information should be the same. It should always be, when you're trying to change somebody's mind, making sure that you're not using too much hyperbole, but you are telling a personally impactful story of why you are concerned and why you believe that A versus B is the right direction or right answer, or would have helped or could help, or the things that you need. But also making it be sort of manageable and realistic. Things like having wellness coalitions working in communities really helps keep people, how it serves your community, giving very specific examples. But it is, knowing the audience you're speaking to. Are you speaking to an individual who's opposed, or having some realistic expectations for that? Because one of the things when I was running for office, that the first things they tell you is, there's people that are going to be yes, and there's going to be people that are no. But the vast majority of people aren't a yes or a no on you yet. So you've got to find, if they're a yes, you don't have to spend a lot of time trying to keep them educated. So the NAMI board of directors doesn't need to be lobbied by other advocates of mental health or suicide. They're already on your team. And the opposition, it's probably not worth your frustration. But for the people who haven't made up their mind or don't know about your issue, that's where you spend your time, and giving them compelling reasons to understand why it's good for all communities to take care of mental health services. There it is so common to hear people separate mental health from corrections and public safety issues. And we've sort of, in my lifetime, moved away from rhetoric that seems to be judgmental about mental health services, even though we know there's still a perceived stigma about services, but we don't really think of it as a moral failing anymore. But if you've been to jail, there's somehow acceptable to imply a moral failing without people understanding that 95% of people in prisons and jails have a mental health or addiction that led them there. And so you can't separate them out and not acknowledge that keeping communities safe by treating mental health is a very it's good for a community. It reduces corrections demands. It makes the community overall safer. It makes people functional. And so that's one of the places where I've spent, because I serve on subcommittees for the corrections, for public safety. I don't serve on health and social services, but always trying to talk about it through that lens of, you know, prison is the largest provider of mental health services in Alaska, Alaska's Department of Corrections. You know, we reference sometimes the state psychiatric hospital, API, or other services that hospitals provide in Alaska, but our prison system is doing more case management of people needing mental health services in Alaska every day than any of our health delivery facilities.
Yeah,
Another
well
long
said.
answer.
No, that was a great answer. Like this is so much more than I expected. This is fantastic, actually. Mel, you just popped on. Did you have something to say?
No, I just was figuring out some of the technical stuff, but this is really interesting, and I think that's like a great point to consider that I haven't really been considering myself, so thank you for that.
Yeah, and so I'm thinking about like the people in the middle, the maybes, the people who really don't have a stance yet. And I have this like incorrect cartoonish idea in my mind that if you're a state legislator that you're an expert in everything and you have solid opinions on everything. There's no way that that's realistic. You're human beings, obviously.
Right.
So is there a difference between me and my role with NAMI Juneau as the director of NAMI Juneau? I guess like, should I think about what I'm doing as just education as well as lobbying? Like, that's kind of a new thought to me. It
Lobbying is
the whole thing. And so these are all new thoughts to me.
Lobbying is education. Now
Okay.
think of it from the teenager's perspective. When you're lobbying mom or dad to borrow the car and for them to pay for the gas and for them to extend your curfew, you got to educate them as to why this is a good idea. It'll teach me responsibility. You know, whatever the party line is of why you believe your case should be made, you better be able to educate them. It's and getting people to understand that there's a lot of gray, you know, there's a lot of gray in the world. And for teenagers, that's always one of the elements to get them to understand that by your parents denying you something you believe, you want, you earned, you deserve, you think they're evil and wrong. But indeed, they may have a much longer telling story from personal experience that leads them to say, I can't take that risk. You know, the nightmare for every parent of a teenager is my kid's late from curfew and I hear sirens, and they go back to them being in an accident, somebody they know dying, you know, and teenagers going, why would they think that? Because statistically, that's what happens. Prom night, car accidents, you know. So for any parent in Alaska, for anyone who hasn't had firsthand experience in their family or directly touched by mental health crises, everybody knows somebody who has been. You know, we're a small state, you know, and you used to think that there could be families who haven't been touched by mental health crisis, and you go, no, every family's been touched. The question is, what do they say about it? Have they ever acknowledged it, or is that just the family member no one talks to, or the thing that's, you know, whether someone was institutionalized, or goodness knows, when someone's life ends by suicide, the number of families that can never talk about that for whatever reasons, personally, you know. And so for families that then come into that world to find out that their neighbors, their cousins, their coworkers have all walked that path before them, you know, is always startling. And I think, you know, with diseases like cancer a generation or two ago, that used to be similar, right? People would say you whispered the C word, you don't acknowledge it. And, you know, I think we're getting closer on mental health crises by educating people and talking about, you know, schizophrenia is not a death sentence. It is a very treatable disease that requires, you know, it's a chronic disease that requires acute management, and very successful people living extraordinary lives with all kinds of diagnosable mental illnesses. But we have to acknowledge that that's things we can do in the 21st century. We have pharmaceutical interventions for some diseases that are very successful. And then we have other diseases where we don't have good interventions, but we know there's still behavioral health modifications that make things treatable, and life can improve and communities can thrive. Kumbaya, you know, we hope that we could come out of a pandemic and all be healthier on the other side, but you know, that's a little bit of that's what we aspire to, but that's not really what we spend our days at the legislature talking about.
Yeah, and so maybe we need to just bring a little bit of that conversation to the legislature.
Yeah, and you know, the legislature functions always in crisis mode. You know, you're keeping the funding mechanisms going, and it's a 2-year political cycle. Everyone's all, you know, the inning's going to change, the players are going to change, therefore the debate's going to change and shift, and trying to drive the debate to an outcome that gets your needs met. And I guess to go back to your, you know, one of your questions about what should people advocate for, and or how to advocate, is to be really clear about, you know, your talking points and your message. And again, one of the things when learning to be a candidate for the first time that was presented, and I coached debates, so I understood this, but know what you're there to talk about and always pivot back to your issue. So there are a lot of red herrings in politics where people will talk about, like, I will expect that one of the dialogues would be, don't people who have mental health issues deserve a full PFD? We need to give everybody a back PFD and put $10,000 to everybody's hands, and then they can help themselves. And to dialogue about that, one, that's not what you're talking about. That's a different political debate, but making sure people have enough money to have their basic needs met is critical. In fact, we probably need to have more programs that put direct assistance into individuals' hands, but it probably should be means tested, because I probably don't need the same assistance as many of your clients need. But we all need our systems of assistance to meet our community's need, so that we don't have homeless encampments with people dying in them, institutions where we're restraining people and they're dying of pandemics and their mental health services aren't being met. We need to make people healthy and be able to live in their communities so that we can all thrive.
So
Too broad a question, see, I'll just ramble on.
Yeah, no, but there's so much, and I want to go in so many different directions right now, and I'm trying to think like which questions, I'm trying to think like which ones are easy for you to answer off the top of your head. I guess one thing that really stuck out to me is you mentioned that corrections is the biggest provider of mental health services and provides the most case management. When I think about our work, we spend a lot of time partnering with Bartlett and JAMI and JYS and Search and other community supports like a lot of the tribal family programs and Zach Gordon Youth Center, the school district, Teen Health Center, like a lot of these other community supports, but we don't talk about partnering with corrections at all. Honestly, it hasn't occurred to me until right now to do so. I'm sure that there's space there to have partnerships. Like, is corrections this impenetrable fortress, or are those human beings that I could speak with?
Well, you know, I guess I'm surprised that you don't partner with them in some regards, and perhaps we're just using different terms, and maybe I'm, you know, things like I actually speculate that many of your clients have had contact with Department of Corrections and have, you know, and if you come into the system and you already have a diagnosis that you're schizophrenic and you get a daily medication, corrections is pretty good about getting that information if it's in your file, or eventually finding it out. And of course the dilemma is the person who's been self-medicating gets in trouble with the law, and then before they get a new in-system diagnosis, we're a year into going, well, gosh, in Fairbanks, his provider and treatment services were at Tanana Chiefs, and boy, how come you guys didn't know this? But there's a lot of siloing in state government, and corrections is one of those. I'll give you a really small example. That a year ago, it's on a different theme than mental health services, but it kind of relates, and that is, it did a simulation with the Reentry Coalition they did here in Juneau, and it's a federal project to teach policymakers and providers about what it's like for reentry coming out of institutions from an inmate's perspective. And so, the chief of police was there, Senator Keel and I, and through the course of the simulation, what becomes, the mayor was there, and she and I ended up remanded back into jail after our first week out, because you did 4 weeks in the hour-long simulation. Was you had to have an ID before you could go and do any of the other things, like go to the bank and cash your money, so that you could go to probation, check in, do your urinalysis, and sign up for your court-mandated therapy. Well, your ID was the linchpin, and when it came down to it was, wait a minute, so everybody who's in prison, we know who they are, right? They're identified, but the day that they get out, they don't have legal ID, and they have to go through a bureaucratic system to get out to DMV and have the $15 and pay for a state ID, and and then they can start climbing the ladder, but the ladder's beyond reach because they don't have the skills to, and means. They're released into a community that they've never been before, and they don't know how the bus system is, and they don't know where DMV and Juneau is, and you go, these seem like sort of artificial hurdles that we've placed in the way, that if everyone got out with an ID and could make their first step something more productive, like going to the bank or showing up at probation. Boy, we all know that if you have a positive first step, reentry for anything is more successful. If your first workout of your new training regime is fun or interesting, then the second one becomes easier. And we somehow don't do that with mental health services or with corrections, and we've truncated those things, so you wait till there's a crisis. And I think that probably that is a place with NAMI and affiliates. In every community that has a state prison, and in Alaska, there's probably a NAMI affiliate, and there's probably a reentry coalition that can hook people up and say, not just meeting your probation officer, but here are community services that you may want to avail yourself to. Here are supports, because all across Alaska, we're a state prison system. So you got arrested and convicted in Nome or Fairbanks, but you served your time in Juneau, and maybe you don't go home, maybe you stay here. So it takes you a while on the streets, and that's one of those other things coming out of prison. You're not supposed to affiliate with anyone who's been in prison, but the only people who will help you are the other people who've been in prison. They're the only one who have the knowledge of how to get out of that trench and how do you make this work? But you're not supposed to ask them for help. So we've done things in a way to continue to silo people, instead of going, isn't the goal to lift everybody up and move them into being productive citizens? But
there's just so much to think about here. I love all this, and I really appreciate it.
Yeah.
My last question for you, I'm just curious if you have any personal connection with the work of NAMI Juneau and the Suicide Prevention Coalition. We want to promote stories of recovery and break stigma and make it okay for people to talk about mental health, whether it's with themselves or loved ones or experiences they've had. So I'm curious if you have any personal connection with our work.
Well, yeah, you can't. So I'll give. I was very young when the first person in my worldview died of a suicide, and it was one of my mother's closest friends. and we called her Aunt Betty. And Aunt Betty was a doctor, and she actually died by a drug suicide, and I think I was 10. And to start, you know, and it's one of those sort of data points that learning about later, that a lot of addiction in the medical field, and you know, she was a very functioning, successful doctor in Alaska. And that probably, you know, was part of an interest in mental health, as well as my mother worked in mental health. She worked at the state psychiatric hospital. As a high school teacher, I probably averaged a student a year that I knew that died by suicide. And, you know, some not while they're in high school. You think that they've fledged and made it successfully, but they've died as young adults. And, you know, very rarely is it the family or the child that you think. Some are ones that are at risk, and people have, you know, worked to intervene in. And every single case when someone's life ends by suicide is heart-wrenching. And again, you know, Alaska's statistics for it are so high, and our population is so low. We all have been touched by suicide, whether we know it for a confirmable fact, or whether it was just never spoken to, and it's what we suspect, that, you know, that's why they've never spoken about it. And, you know, by and large, for me as a teacher, I would say it's more young men than women. The statistics bear that out in Alaska. But probably two of the most heart-wrenching of the students I've lost to suicide were both young women. And, you know, there were risk factors going into that. Both of them had been victims of sexual assaults. And, you know, we can layer that on top of Alaska's ugly social ills, and know that those are things that happen, and those are things that put people at risk if they have been sexually assaulted. It is a definite risk factor for other mental health needs and demands, whether it's addiction or self-harm, coming out of that and recovery from it. So, yep, we've all been touched.
Yeah, absolutely. And I appreciate the reminder that there's like many different ways to be touched by these issues. So thank you very much for your time. I appreciate it. This is a head full of information for me. I would quite honestly love for you to give people a pep talk before they go and speak to their elected officials, because I think you have a lot of good insight there. We're recording this, so I'm going to share it with folks that are interested in engaging at the state level. So appreciate all the insight. It got me excited and energized, and I feel like I have new ideas and ways to think about our work.
Yeah, and Erin, take me up on that. I would be happy to, you know, come do a teacher lesson on how to be an effective lobbyist and who to go talk to.
All right. Well, I really appreciate it.
Yeah. Thank you for all your work, and for everyone who is online and joining you, and your commitment to making the planet a kinder place to be, and our community healthier by delivering services to the diversity of people who need them in our communities.
Thank you for the kind words. I appreciate it. To round out this week, tomorrow we have a presentation on peer support. Thursday we have 2 stories of recovery, one from a military veteran and one from an active duty military member. And Friday we have a sale talking about traumatic and acquired brain injuries. So with that, hopefully some folks who are on right now can tune in for the rest of the week. And Sarah, we have folks typing in saying thanks to you on both Facebook and in Zoom. With that, I'll say good day, enjoy the sunshine. Thank you for your time.
Thank you.